COVID-19 Coronavirus Disease 2019 by Jessica Santiago Reeves. COVID-19 originated in Wuhan, China. A 55-year-old from China was the first case that was detected back in November 17, 2019. Authorities traced COVID-19 origin to the Hunan seafood wholesale market in China. Authorities state COVID-19 came from animals passed on to humans. COVID-19 is a disease caused by a virus named SARS-CoV-2. It can be very contagious and spread quickly. The symptoms consist of fever, cough, shortness, difficulty of breathing, chills, repeated shaking with chills, muscle pain, headache, sore throat, loss of taste or smell, and even diarrhea. Symptoms may appear 2 to 14 days after exposure to the virus. COVID-2019 through 2020 timeline. November 17, 2019, first case in Wuhan, China. January 2020, COVID entered the U.S. in the state of Washington. March 2020, COVID-19 global health emergency. WHO declares pandemic. April 2020, U.S. announces Operations Warp Speed to develop a COVID-19 vaccine. June 2020, U.S. reports 2 million cases. August 2020, COVID-19 becomes third leading causes of death in the U.S. September 2020, global death reaches 1 million. December 2020, the Food and Drug Administration issues emergency U.S. authorization for COVID-19 vaccines. COVID-19 events 2021 through 2023. Starting in January 2021, COVID-19 variants are reported in the U.S. and across the globe. February 2021, COVID-19 cases surpass 100 million worldwide with 2 million deaths. March 2021, over 100 million cases COVID-19 vaccine doses have been given in the U.S. October 2021, WHO defines long COVID-19 as a combination of symptoms people may have 3 months after they test positive for COVID-19. November 2021, the FDA approves booster mRNA vaccines for everyone ages 18 and older. January 2022, FDA approves the Moderna COVID-19 for everyone ages 18 or older. March 2022, FDA authorizes second booster dose of mRNA vaccines for adults ages 50 and older. June 2022, more than 85 million cases are recorded in the U.S. July 2022, the FDA approves the Pfizer-BioNTech COVID-19 vaccines for people ages 12 to 15. February 2023, worldwide tally reaches 755 million COVID-19 cases and 68 million deaths. May 2023, the WHO declares an end to the public health emergency of international concern. COVID-19 caused a global pandemic and had a huge impact on the U.S., causing a shutdown, also a restriction on being 6 feet apart, and even wearing face masks every time you would step out the house. As a result, shortly after, 3 vaccines were passed and strongly urged to get one. COVID-2019 vaccines. Moderna COVID-19 vaccines 2024 through 2025 formula is indicated for people 6 months through 11 years of age. Moderna Spikevax is indicated for people 12 years and older. The Moderna mRNA vaccine works by triggering an immune response against the SARS-CoV-2. Pfizer-BioNTech COVID-19 vaccine is indicated for individuals 12 years of age and older. Pfizer-BioNTech COVID-19 vaccine is indicated for individuals 5 through 11 years of age and individuals for 6 months through 4 years of age. Novavax COVID-19 vaccine approved for all people ages 65 and older and for people ages 12 to 64 years with a risk for serious COVID-19 illness. COVID-2019 has spiked the averages of death. Over 800,000 Americans have died due to COVID-19. The number of deaths has fallen significantly due to vaccines. COVID-19 changed life drastically during the pandemic. It was very dangerous for many elders and people with low immune systems. COVID-2019 had a huge impact on healthcare workers mentally and physically. Healthcare workers risked their lives and health in helping people who were infected with the virus. Workers had to work very long, stressful shifts while workforce shortages were worsening and straining their mental health. Healthcare workers were very burnt out physically and mentally during this pandemic while not having enough equipment or staff. Life after COVID-19 wasn't normal. At one point, there were restrictions on wearing a face mask anywhere you go, protocols on social distances. There were also no social activities. Even schools were transitioning to being remotely. COVID-19 introduced new adaptations to adapt to and changing our health and changing how we live, interact, work, and even on the way we interact with each other. And this is a page of my resources.